Hi, everyone. I'm Dr. Sandeep Vaishnavi. I'm the medical director of the Transcranial Magnetic Stimulation, or TMS, program at MindPath Care Centers here in North Carolina in the US. And I just wanted to discuss a little bit about this technology and how it can be helpful for patients with major depressive disorder as well as obsessive compulsive disorder, or OCD. And I'd be happy to take any questions from anyone. So if you want to go ahead and send in your questions now, either by live chat or by other means, and then I can go ahead and answer those questions. So let me just talk a little bit about what TMS is. So it stands for Transcranial Magnetic Stimulation. And what that technology is basically a way of using magnetic pulses to directly impact the brain. So what we're doing with TMS is that we're actually directly stimulating different circuits in the brain. And by doing so, by targeting certain circuits, we're able to improve symptoms of neuropsychiatric disorders such as major depression or obsessive compulsive disorder. Now, this technology has been around for a number of years, but it has been approved by the FDA for major depression specifically for at least 10 years, more than 10 years now. And it's been used on thousands of patients across the country and indeed the whole world with a lot of good results. And we're going to talk a little bit more about some of those results in just a bit. But I wanted to kind of give you an overview first of TMS and kind of where it fits in terms of treatment for depression. So as we know, there have been a lot of medications that have been approved for major depressive disorder. And of course, there's talk therapy, different types of evidence-based talk therapy. And all of those can be very useful for patients with major depression. Unfortunately, there's a substantial portion of patients who don't respond to these treatments. And that's where brain stimulation techniques such as TMS may be quite helpful. So specifically, what we usually do with TMS is that we have patients who've been through medication management, they've been through talk therapy, and they could be having both of those ongoing, but then also they start using TMS. And the way TMS works, as I mentioned earlier, is that we're using magnetic pulses. So we're really using the benefits of the electromagnetic field, which is, by the way, what all of our modern technology is based on. So everything from your radio to your TV to your cell phone to Wi-Fi, internet, all of that is based on the same general technology using the electromagnetic field. And now we're at a point where we're able to use that technology to directly impact circuits in the brain. And it seems kind of normal now that we've been doing it for such a long time, but you really have to step back and think about how remarkable that really is. So we're able to actually change how your brain circuitry works by using this magnetic technology, this TMS technology. And this is something which really has never been done in the history of humankind before relatively recently. So it is really kind of a remarkable technology where you can do this in an outpatient setting. That is, that there is no anesthesia. It's done in the clinic. It's not painful in terms of regular ongoing pain. There is some discomfort that can occur initially as you adjust to it, but 98% or so of patients in clinical studies have been able to do just fine, tolerate the treatment. It is an ongoing treatment. That is, that it is 5 days a week for 6 weeks is typically how it is. And then there's a weaning period over the next 3 weeks. And so each session is typically around 20 minutes or so. The first time that we do TMS, we do personalize it to each individual. So we basically find the right strength of the magnet and the exact right location of the magnet for that individual. And then we check on that on a weekly basis, because different things like your amount of sleep or medications can change the strength of the magnet that we need to use. So we can look at that on a weekly basis. But overall, typically each session is 20 minutes and 5 days a week for 6 weeks, as I mentioned. And then in the 7th week, we typically have 3 sessions. In the 8th week, typically 2 sessions, and then 1 week in the, 1 session in the last week. So it's basically 3, 2, 1 sessions over 3 weeks at the end of the 6-week initial treatment. And so one thing which is remarkable about this technology is that the data that we have is that the benefits can be quite long lasting. So there is a study and a number of studies now that looked at sort of long-term outcomes with TMS. And from what we know, when people have looked at it a year out, and a year was just chosen for this study, but when people looked at it a year out, what was found was that the majority of patients who received benefit from TMS continue to receive TMS at that 1-year point. Now, the only caveat, of course, is that with TMS, that doesn't mean that you stop all other treatments for depression. Oftentimes, people do continue on medications and therapy. And the way to look at TMS, I mean, it's not a cure for depression. Unfortunately, we don't have a cure for depression. No medication, no therapy is a cure for depression. Depression is a relapsing, remitting disease. In other words, it tends to be chronic and relapse, and so there are additional episodes that can occur. However, what we're doing with TMS is that we're literally causing changes in your brain, which I'm going to discuss a little bit more in just a minute. Changes in your brain, really rewiring your brain in really a fundamental way, so that there are long-lasting effects. And then what we typically see is that the benefits that people find with TMS is that it sort of gets them to that next stage. So let's say you're in a very deep depression, you're not able to get out of that depression. What TMS can do is get you to that next stage where you're able to actually function a lot better, and then you can do things to help your brain, will do things that are good for your brain and good for your mood, such as good nutrition, such as stress management techniques, such as exercise, social interaction, etc. So things that we all know that are good for us, that are good for our brains. Oftentimes when people are in the throes of deep depression, they can't do those things. I mean, they know that they should do those things, but they can't make themselves or bring themselves to do those things. And TMS is one method, a very, I think, a powerful method by which you can get to that next stage and then do the things that that you know will be beneficial for you to help maintain your mood. The other thing to mention is oftentimes medication benefits are actually better after TMS. So the medications may be helpful to help maintain basically the benefits of the TMS. The other point to mention is that if you're on multiple medications for depression, it may be possible to streamline your medications so that you're not on so many or on such high doses after you've had TMS. So there are many things that can change after TMS, but we do think that it can definitely present some long-term benefits. It's really based on this concept of neuroplasticity. So basically the idea here is that your brain is always changing, even as an adult. We know kids have a very plastic brain. In other words, kids learn very quickly. We all know that kids can pick up languages much faster than adults, for example. And but even as an adult, of course, you can learn new things, and you are learning new things all the time. So the brain is able to change. The brain is able to learn, and learning, by the way, is causing physical changes in the brain. So what we're doing with TMS is that we're actually helping the brain change in a faster way. So the basic concept, just kind of boil it down here, is that in depression in particular, the emotional brain is on and overactive. It's basically on too much. So emotions are important, of course. I mean, we need emotions to survive. Actually, this has been studied. People who have neurological disorders where they don't have good emotions, like fear, for example, they don't survive very long. There are reasons that we have the emotions that we have. And so we want to have emotions, but what we don't want is to have emotions that are not in line with what's actually going on externally. So in other words, let's say something bad happens in your life and that makes you sad and down. That's appropriate, right? What may not be appropriate is that that sadness, that lack of enjoyment persists for weeks and weeks and months. And so that's the emotional brain being overactive. So the cognitive brain actually helps modulate, it helps kind of control that emotional brain activity. So the cognitive brain's job is not to stop the emotional brain. The cognitive brain's job is to modulate the emotional brain, to make sure that the context is right. In other words, after maybe a few weeks of sadness, let's say, or let's say a few days of sadness, your emotional brain doesn't continue to keep going and going and going, because that would lend yourself to a diagnosis of major depression, right? So the cognitive brain is able to modulate it, kind of tamp it down, have the appropriate emotional response. With TMS, what we're doing is we're actually activating the cognitive brain. We're actually strengthening the cognitive brain, which in turn helps the cognitive brain modulate the emotional brain. So it's an indirect way to modulate your emotions, but a very effective and a very powerful way to do that. And just to give you a sense of how powerful it can be, in usual clinical care, so looking at studies that have looked at the outpatient clinical care setting, what we find is that up to 2/3 of patients may actually have significant benefit from TMS. Now, these are patients who have tried and failed medication and therapy and have tried everything else that they can for depression. So even among this really tough to treat patient population, we find that approximately 60% or 2/3 of patients do get significant benefit. And when I say significant benefit, that means having at least a 50% reduction in your depressive symptoms as measured by standard clinical rating scales. So this is a real benefit, a really clinically significant benefit, and most patients do get that benefit. And in fact, 1/3 of patients can go all the way to remission. And so remission is where the depression symptoms are so low that that they are essentially almost non-existent. They're very much normalized, right? So our goal always with any treatment for depression is to get to remission, because remission, of course, is is good for everyone involved, and it also may help in preventing having further episodes. In other words, it may help prevent relapse of the depression. But it may not, you may not get to that point of remission, but you may get to the point of having a clinically significant response, which is that 50% reduction in your symptoms. So again, 2/3 of patients get to that point where they get clinically significant reduction in their symptoms. So that's quite impressive, I think, especially in this patient population. So I do want to convey this to viewers that there is hope for people who've been struggling with depression with this new type of technology. It's really a paradigm shift. It's really a new way of looking at a depression, and it is something that can be complementary to medication and therapy. There's no contradiction here at all in terms of these different treatments. The other thing is that in terms of the practical aspects of TMS treatment, you don't need a doctor's referral. You can call on your own and set up a consultation. Here at MindPath Care Centers, we do offer a free phone screening consultation, and you can actually see how to contact us here on the screen. So so feel free to contact us and to kind of get through that screening process. And if you're a good candidate on a phone screen, we would then set up an in-person or virtual consultation, and then we would, if you're a good candidate at that point, we would go ahead and file to your insurance. The good news about insurance is that a lot of insurance companies are covering TMS. Most of our patients are going through insurance and getting coverage. So insurance companies have realized that this is something beneficial for them, for their bottom line as well, because this is a treatment that works for a lot of people, and it helps lower costs overall. In terms of other practical aspects of TMS, the benefit of this, again, besides the efficacy that we just talked about, is safety. It is a treatment that is generally very, very safe. It is done in the outpatient setting. You don't have to go to the hospital. There's no anesthesia, none of those kinds of things, which with ECT, ultraconvulsive therapy, of course, there is. That is still a very potent and used method for treating depression where nothing else seems to help. And ECT definitely has a role still to play, but ECT is definitely more invasive. So you do have to have anesthesia because with ECT there is induction of a seizure, and it has to be done in a safe environment. It has to be done in a hospital environment. So there are a lot of logistical issues with that. You'd have to have someone be able to take you to the hospital because you're recovering from anesthesia and take you back. So a lot of logistical hurdles there. But again, still a very important treatment for certain folks. You can think of TMS as sort of an in-between step. So in other words, you have your medication management, you have your therapy, and perhaps you haven't had the benefit from that. Then TMS could be your next step because it is more potent than the other treatments and medication management and therapy. But it is more invasive. Of course, we are stimulating your brain. And so it is more invasive than those other methods, but it's actually less invasive than ECT because you don't have anesthesia and so forth, as I mentioned. So as an outpatient procedure, one of the benefits of TMS is that you can come in, have your brain stimulated, and leave. You can drive yourself. There is no downtime with it. It is on a daily basis, as I mentioned, for 6 weeks, but people can do it on their break or whenever they can come in. It is something that that doesn't cause any problems for the rest of the day, and that's not the case with other treatments like ECT, because with ECT there can definitely be cognitive issues, memory issues, things along those lines, and that's not the case with TMS. There is no cognitive impairment, that is, no memory problems or attention problems with TMS. And if anything, it may actually help because depression itself can cause some of these problems. And improving the depression will actually improve your cognition. So you're able to resume your normal activities after treatment. It is something that we've been doing now for a number of years here at MindPath Care Centers. And overall, in terms of safety, it is a very safe procedure. There is a very low risk of any significant problems. The main side effect, if people are going to have any side effects, are related to the fact that we have this magnetic pulsation on your head. And so there is a literal tapping on your head that you'll feel. And so especially during the first few sessions, there can be some discomfort. And in people who are vulnerable to tension type headaches, they may have headaches. Again, for the vast majority of people, they are able to tolerate that. In fact, your brain actually gets used to this quite quickly, or usually over the first few sessions, people are able to kind of get through it and then don't have any problems for the rest of the treatment. So this has actually been looked at in terms of people's discomfort. It really goes down dramatically after the first few sessions. So for the vast majority of people, they're able to be comfortable while they're getting TMS. You're in a chair and you have a helmet or the magnet. There are different types of TMS. They look a little bit different. But the two types of TMS that we have here at MindPath Care Centers are the two that are FDA approved. With both of them, you're sitting comfortably. You're getting your brain stimulated for a certain number of time. It's actually just seconds. And then there is a break in between. And then again, you're stimulated for a certain number of seconds. And then there's again a break. And then again, stimulation. So it goes back and forth, and typically again for about 20 minutes. So that's sort of the logistical part of it. Safety-wise, as I was saying, it's very safe. There, of course, are some risks, and those are risks that we would talk about at the consultation. Look at your individual case and see if you are indeed a good candidate for this treatment. Not everyone necessarily will, but a lot of people will in fact be good candidates because it is so safe. And again, it is very effective for a lot of people. So one thing, of course, we're all thinking about right now is the coronavirus pandemic and how to manage this sort of treatment safely. And I will tell you that here at MindPath Care Centers, we're doing a number of things. One is that we're doing touchless TMS. That is that once you have been approved for treatment, you're going to go ahead and start treatment. You will be notified by your cell. We'll text you while you're in your car, so you don't have to go in and be in a waiting room or anything like that. So when we're ready to go ahead and treat you, we'll text you while you're in your car in the parking lot, and we'll open all the doors so that you don't have to touch anything. You can go right into the TMS treatment chair. So that's one major thing. The other thing is that we are very conscious of using personal protective equipment, PPE as it's called now. So with masks provided for all the patients, as well as, of course, all the clinicians. And by the way, there is always a TMS technician in the room with you, and they will have a mask on as well. We have hand sanitizers available everywhere that we're using quite a lot. And we're keeping social distancing as best we can. That is that after fitting the helmet on you and getting started, then there's no need to be actually close to you. So we're 6 feet or further away from you while in the room. So those are all ways to sort of minimize the risk. Of course, we are cleaning very thoroughly between each patient. Also, you should note that the 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 TMS, different TMSs have different ways they do this, but basically for both of the major types of TMS that are FDA approved, and we have them here, the contact between the magnet and your head is with something which is disposable or is personal to you. So it's not that it would be the same thing that's touching other patients. So hopefully that can also be reassuring that with the NeuroStar TMS, one of our major forms of TMS here, there is a contact that is on the magnet. It's actually a sensor that makes sure that you have good contact. The magnet, the helmet has good contact. And it also is disposable. So we change that between every patient. With the BrainsWay TMS, the other type of TMS that we have available, you have a cap, which is a fresh cap for you. It's personal for you, and no one else uses that. So anyway, there are various ways that we have to sort of, again, mitigate that risk. And so ultimately, it is something that has to be done in person, but I think there are lots of ways to sort of minimize those risks, and we're following all the CDC guidelines and anything else. We're following very closely any public health announcements, any recommendations that are coming from public health officials, and we're following them meticulously. So the other point I just wanted to make in terms of certification for clinicians, physicians who are doing TMS, just to give you my background, I'm the medical director, as I mentioned, of our TMS program. And so I am have been trained in neuroscience, cognitive neuroscience. That's my research background. And medically, my training is after medical school, I did a psychiatry residency. I also did a psychopharmacology residency. And after that, I did a fellowship in behavioral neurology and neuropsychiatry. So my residencies were done at Duke University, and my fellowship was done at Johns Hopkins. And I'm board certified in general psychiatry, and I'm also certified in behavioral neurology and neuropsychiatry. Now, the other physicians in our program are also all, of course, trained well and certified. They also have been through training with TMS courses. So different places around the country, including Duke University, have been doing training courses for doctors, for clinicians, and our doctors go through those training courses as well. And I mentor all of our doctors and sort of help train them as well in terms of TMS. So I feel like we've got a good group of doctors who are well trained, and we actually have very good results. I mentioned overall the results kind of nationwide in terms of clinical trials, 2/3 of patients can have significant improvement. Well, our treatment results are actually well above that. And so we're very, very proud of that and very happy about that. And we want to have the best quality program possible. And we're doing everything we can to do that, to improve your symptoms. So in terms of where we are, we have TMS available at various locations. I'm actually based in Raleigh, Sidus Court in Raleigh, We also have TMS available in Durham. And we do have another TMS machine at another Raleigh clinic. And we're hoping to expand across the Triangle and elsewhere as well over time. So we have, at this point, we have 4 TMS machines, and at these various locations. So we can do a consult, by the way, anywhere, and we can actually do that virtually right now, especially in the context of coronavirus. So the consultation will oftentimes is, in fact, through a platform that we use, a software program that we use, easy to use program, where you can see the clinician, they can see you, and we can discuss and do a consultation. Look at the pros, look at the cons, look at the benefits potentially for you individually. And so we do that, and then once we get it through insurance hopefully approves it, then we can find a location that is closest to you. And like I said, we do have multiple locations, and so we should be able to find a location that works for you. So that's overall. I've been kind of answering some questions that have been coming in as I've been talking. And if you do have any other questions, feel free to ask me, and I would be happy to answer them. All right. Well, thank you very much. I'm just going to hold on and see if there are any other questions that may arise. And if not, otherwise, I hope you have a good day and stay safe out there. All right, I do have a question that has come up, which I want to address in the last few minutes here. So one of the questions is related to yes, this has been approved. This technology, TMS, has been approved for a number of years for depression. And the question is really related to OCD. So how does it work with OCD? And I've been focusing mostly on depression because the approval has been for depression for since 2008. With OCD, it's a newer approval by the FDA. It's just recently been approved for this disorder. But I want to talk a little bit, just briefly, about that. With OCD, obsessive compulsive disorder, it can be a very, very difficult disorder to treat. And there is a very high rate of folks who don't really respond very well at all to typical medication therapy as well as talk therapy, even the best evidence-based treatments that we have. And so what the OCD treatment is, it's a bit different actually than what we do with depression. With OCD, it's actually with the BrainsWay OCD coil, with that magnet specifically. So unlike with depression, there are many, many manufacturers, but with OCD, it's specifically with this particular manufacturer called BrainsWay, and they have a particular type of TMS that they use called deep TMS. And it's called deep TMS because it actually stimulates deeper into the brain, and it's more pervasive. That is, the stimulation goes through a bigger slice of the brain, bigger portion of the brain than the other TMS devices that we have. So with OCD, it's also a daily treatment. It's also over 6 weeks. However, the difference is that there's actually a behavioral component as well. There's an exposure therapy component to it. So let me explain this a little bit. So let's say you have OCD, or your loved one has OCD, and you have a fear of contamination, fear of germs, let's say. All right. Of course, right now with the coronavirus pandemic, a lot of people have that. But if it's to the point where it is pathological, it's really bothering you, let's say it's not just sort of related to what's happening right now. So what we would do is that at the first session, we would actually find out a trigger. What's the best trigger to sort of let you start thinking about the obsessions and the compulsions that you have? So sometimes it is a little bit uncomfortable because we are exposing you to what may be uncomfortable to you, but there's a reason for this. There's a good reason for this. The reason is that we're trying to get the brain to understand that, yes, it's uncomfortable, but it's actually in the end tolerable. Nothing horrible will actually happen, right? So for example, let's say, you have OCD and you're washing your hands over and over again repeatedly, or you have OCD and you have a fear of saying bad words, even though you really don't do that regularly, but you have this fear, whatever it may be, we're going to come up with a particular trigger. It could be reading something, it could be a picture, something along those lines that triggers some of these symptoms. I mean, we don't want you to get overwhelmed with the symptoms, but we want you to have a moderate trigger, a moderate response to these symptoms. And then after you start thinking about that, then we go ahead and start the brain stimulation. And the rationale for this is actually that we want to have the brain stimulation occur while you have certain circuits that are active in the brain. So by giving you that exposure, we're activating certain circuits in your brain, and then at that point we're actually doing the brain stimulation. So with OCD, we're actually causing changes in that particular circuit by first getting that circuit to be activated and then using TMS. So it actually has to be done in that particular order. And the stimulus may change over time. The exposure stimulus may change over time, depending if you get used to it, et cetera. But we do do that as well as part of our TMS program. It's as I said, it's relatively new in terms of approval, but it is something that we have had patients and we've had success with this as well. So right now, it is in fact major depressive disorder as well as OCD that are FDA approved. And I do know that there are other potential indications coming down the pipeline. For example, the FDA is reviewing a study right now for using TMS for smoking cessation for people who are long-term smokers who've had a lot of difficulty in stopping their habit. There was a study that was done, a randomized controlled study that showed benefit of TMS for that. And of course, the target is different for different indications, meaning we're not going to stimulate necessarily the same part of the brain. It's all based on what exactly the circuit is. So TMS is really applied neuroscience. I mean, it's really understanding your brain circuitry, and then being able to use that information to then improve the symptoms, to basically improve that circuitry. So smoking cessation, potentially cognitive impairment, memory issues. There are studies that have been ongoing about that, PTSD, bipolar disorder. So there are a number of indications, hopefully down the road, that the FDA will approve, but all based on this same general technology, TMS technology, which, as I mentioned at the very beginning, is really a very potent technology. And I would encourage you to look into it and contact us if you'd like to kind of explore this a little bit further. And we'd be happy to teach you a little bit about TMS and how it works, and then hopefully be able to do TMS and improve your symptoms and sort of alleviate the suffering that you've been going through for such a long time. All right. Well, thank you so much. If there are no more questions, I'm going to end our session today. All right. Stay safe. Thank you. Bye.